Good morning. Welcome to Breakfast with Roger Johnson and Sally Nugent.
It's 7:30. The vaccine rollout in England is set for another big week as Twickenham Rugby Stadium is converted into a mass vaccination centre.
Ministers want to give all over 50s a second dose by the date England's remaining restrictions could be lifted. Well, let's speak to our GP, Dr. Nigat Arif. Morning, Nigat. Lovely to see you this morning. So we are seeing this extra push, aren't we, at the moment? The Twickenham push today and vaccination centres being left open as long as possible, very much encouraging people to come forward. And that is because of this concern over the June the 21st date. What do you make of all of this?
Well, we've been vaccinating out of not fit for purpose buildings. And by that, I mean not medical centres. So mosques, synagogues, gurdwaras, community centres, stadiums up and down the country have been used in a way that we can get this vaccination programme up to speed. Remember, Sally, 29.4 million people have had their 2 doses of the vaccine. And we know, especially from the data that came out from last week from Public Health England, that if you have 2 doses of the vaccine, then we can combat the variant. Now, we do have 9,000 cases of the COVID Indian variant as well, that we need to be making sure that we keep those numbers low. Variants will happen where we don't have a control on the virus. But the Pfizer vaccine, if you get 2 doses of that, 80% coverage against the India variant, the AstraZeneca, 60%, which just shows that having 2 doses is really, really important. So when you're called for your vaccine, please go. But this is really encouraging because we know that there's no issues with supply at the minute. So why not? Why not just roll this out and make sure that we're getting everybody covered? Because June the 21st is a date that's set in a lot of people's mind. And the expectation is that we're going to come out. But we've got to come out safely. And so we're just trying to put the steps in as clinicians and the system as a whole in the NHS to make sure we have that. Because I think if we don't meet that target, in a way, there's going to be disappointment. There's a lot of unhappy people as well. But also, there is COVID fatigue. People are just tired of this. We as healthcare professionals are tired of the restrictive measures as well. I know that they're for the right reasons, so I completely get that. But there is that sort of sense that people aren't going to really follow the rules if this goes on any longer. So keeping up with making sure we're washing our hands, wearing a mask, physically distancing, getting your vaccine, and just, if you are with friends and things, sitting in a well-ventilated area, just means that we're not spreading that virus and hopefully get to the 21st of June, which is 3 weeks away, Sally.
I know, it's 3 weeks today, isn't it? I mean, it's interesting you should talk about, how psychologically wedded are we to that particular date. But among the clinicians that you speak to, what is the mood about the 21st of June? How likely do you feel that is that things really will change on that day?
I think that I would say that there's a category of 3 people that I meet. Some people who are really setting all their hopes on that. So business people, people whose livelihoods depend on that day, and they're really planning. I mean, wedding seasons, for example. I know from my culture, there's going to be lots of weddings planned in that around that time. So there is that. This is going to definitely happen. Then there are people who are slightly cautious, and they're saying, well, I don't know what's happening with the variants, and this is a global pandemic, and we mustn't forget that. And then the third group of people who are really apprehensive that we won't meet that date, and they're really actually worried about the fact that we are going to be coming out of all the restrictive measures, knowing that variants do happen, and knowing that if we do go into a 4th lockdown, they're almost preparing for the inevitable. But actually, as doctors and healthcare professionals, what I'm seeing on the ground is that the numbers are low. We've got very low admission rates. The vaccine, even 1 dose of the vaccine gives you 90% coverage against getting sick from the virus and ending up in hospital. But we're now dealing mostly with the mental health impact that this has had, and also long COVID symptoms. That's coming more and more in general practice. And general practice is under pressure. There's no way that I can deny that. My NHS colleagues are working today on Bank Holiday Monday, and I salute them today because I know how difficult it is, and I hope that they're doing all right. But we need to make sure that we also look after our finite resource in these difficult times. So it's just understanding how we come out of our lockdown safely.
Now, the vaccine centre that we've been at this morning in Bolton has a new female-only queue. How important is that? How much of a difference will that make?
I think it will make a huge difference. So as a Muslim woman, I come from a very conservative community. And so sometimes it's nicer just to see a female person who can vaccinate you, because you need to bear your arm. And in some faith groups and in some culture groups, actually that puts them off. we have had vaccine hesitancy, and we can't deny that. I'm part of a group of doctors, part of Team Halo, 70 clinicians across the world who work in union with the UN. And we found that there are certain barriers in order to for people to get the vaccine. It could be as simple as just getting a ticket or a train journey or a bus journey, because that's a cost that they just can't have at the minute. It could be simple as cultural factors. It could be as simple as the fact trust. They just don't have the trust within the vaccine. So we've used novel ways as part of Team Halo to try and combat that by using social media. I've done lots of videos in Urdu and Punjabi, and also just as a Muslim woman showing that you can do it in a very sort of safe environment. But the great thing is that, all our content has been consumed and it's built that trust. So having women-only queues or women dealing with women might just put some of those individuals at ease as well, which is, I think, a good thing to do.
Oh, Dr. Nigat Arif, it is lovely to talk to you. Thank you so much for joining us on this bank holiday.
I'll have my cup of tea
Monday.
now.
Oh, brilliant. I'm going to have mine. Cheers.
Yeah, cheers, everybody. Have a great bank holiday.
I love the way that we've supplied you with a branded mug, though. That's great, isn't it? They're collected. I didn't know we were allowed to take these out of the room.
Only for special people, Rog.
Into trouble. Right, let's have a look at the sport. 7:36. Gavin is here this morning. Morning.
My mug as well, by the way.
Yeah, but you'll get frisked on the way out, so don't try and pinch it. Tell us about Naomi Osaka. It's nothing to do with her tennis, actually, but there's a row brewing.